Vanakkam makkale. This will be the first episode on spine, and in these episodes we'll be discussing about the general causes of pain over your spine, and we'll be discussing about how to prevent it and how to take care of the spine without much of pain and dysfunction for the entire life. Okay. We'll also see, generally we'll take, when you think about spine, the spine can be divided into cervical, thoracic area and the lumbar and this sacral area. This is sacrum, the last tailbone we call it as. This is the sacral area. Okay. So when there is a pain over your neck, this area around your neck, the pain can travel from here till your shoulder, and mostly when the pain is localized, it will be mostly a muscular pain. And if suppose the pain radiates down your arm, entire to the in the entire arm, then it will be related to your nerve problem. Okay, so we call it as neural claudication. So the pain travels from your neck and it crosses one or two joints. A muscular pain doesn't cross like more than a joint, but a nerve pain crosses. It crosses to the entire arm, and it is then that symptom is called as radiculopathy or radiating pain. Okay, so that is the difference between muscular and nerve pain. And if there is a pain around your midback, and that is from here to here, and even that pain can radiate around your rib, chest wall, anterior, I mean in the front and in the back side where your scapula is there, and that is about your mid thoracic pain. Mostly this pain is postural, where you will go for this bend, keep on sitting in front of a monitor in a kyphotic posture. Okay, and the third one is your lumbar, and this is the most commonly affected area, this lumbar. Okay, and the lumbar and cervical clinical features will be like same. Sometimes it can be local, sometimes it can radiate down your entire leg. So when it gets radiated around the entire leg, then it is called as radiculopathy in your lumbar area. So that is your nerve pain. If it is localized, mostly it will be muscular, and even the disc symptoms may also be localized in the grade 1, and then it goes to grade 2 and grade 3, and in the final grade it goes for radiating symptoms. And then fourth one is your sacral pain, where the pain originates in your sacrum and in your seating area, and that is like pain on your tailbone. Okay, and this pain generally occurs for during prolonged sitting, or you had a fall on your back, then the pain starts from here. Okay, these are the generalized pain. And whenever this pain comes, see, the first homework what we should do is rest, ice. So homework is to reduce your pain or to take care of yourself, self management. You will go for a complete rest. Rest for a spine is not sitting, it will be always lying. It is not your peripheral joint. You will sit down, you will put on brace and you will rest. This joint is on rest. It is not like that for a spine. If it is a spinal pain, the resting position is lying completely on the bed, not in a semi-reclined position, not in the chair. It is like complete lying. Lie down and keep eyes and wait for at least 24 to 48 hours and check whether the pain is coming down. Ice pack whenever there is a muscular spasm or a trauma, and if it is an acute pain, and particularly for the spine, if you are in a rest period, better to keep ice 15 minutes in duration 2 times a day, like morning and evening when the sun is high. Keep ice somewhere in the mid morning around 9 o'clock, and keep one more session somewhere around 4 o'clock, and if possible even a third session of ice also can be kept in between in the afternoons, and wait for the pain reduction. If the pain reduces by 24 to 48 hours, you are well and good, and you can slowly start your day-to-day activities. And if the pain is not reducing, still remains the same, or it is getting aggravated, then you need a medical attention. Thank you.